Hello, my friends. Welcome back to the Diverse Thinking, Different Learning podcast. I'm your host, Dr. Karen Wilson. Today, we are diving into a new topic for the podcast, functional neurological disorder, or FND. If you're a parent whose child has been diagnosed with FND, you may have felt scared, uncertain, or even frustrated trying to navigate the road ahead. So to help us understand what FND is, why it happens, and what families can do to support their child, we are joined by Dr. Samantha Levy, a clinical psychologist with extensive experience working with children, teens, and families dealing with complex medical and psychological conditions. You may remember Dr. Levy from our previous conversation on chronic pain, an episode that resonated with so many of our listeners. If you haven't listened to that one yet, be sure to check out the show notes. There's a link to it there. So today we're going to break down the key aspects of FND from its neurological and psychological components to the impact of stress, anxiety, and even social factors like TikTok. More importantly, we'll discuss what parents can do, what to say, what not to say, and how to help their child regain control over their body and emotions. Let's jump in.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Dr. Levy, welcome back to the podcast.
Thank you. I'm happy to be here.
I'm so glad that you're back. I think we discussed having you on for this particular topic and discussion when you were here last, as we were talking about chronic pain. And so glad that we were able to, again, schedule you to come back and talk about this particular topic.
Yeah, and I think it makes sense because chronic pain and functional neurological disorders often go hand in hand in the same person.
Yes. So today we are talking about FND, functional neurological disorder. And I thought maybe we can just start by defining, if you could help define what it is and maybe even how it's different from other neurological conditions that people might think about.
Sure. And I want to start out for the parents that are listening, and saying that I realize how terrifying FNDs can be to witness your child's body being so out of control. So I hope that through this podcast, we can give some hope and calm to parents who are listening. So in medicine, in terms of functional symptoms, in medicine, a symptom or a cluster of symptoms is labeled as functional if there's no underlying anatomical or pathological or physiological reason for them. So nothing can be seen on lab tests or on imaging. And despite the lack of medical evidence underlying these disorders, it really is felt in the body, and it's not the patient faking the symptoms. So a common functional disorder would be functional abdominal pain, where someone has abdominal pain, but you can't figure out why. So in terms of functional neurological disorders, these have been seen throughout history. They've been under different names. It's only very recently that they've been called FNDs, or functional neurological disorders. Originally, they were called hysteria because doctors thought that women who displayed emotional or somatic symptoms were hysterical. They would take out the uterus as a treatment, and that was why they're called hysterectomies still. Terrible history. And more recently, they were called conversion disorders. So most clinicians know these as conversion disorder. Now we call them functional neurological disorders. And that's when the body displays what looks like a neurological disorder, despite no medical origin or explanation for the symptoms based on medical imaging or EEG.
Yeah. And you talked about, stomach pains being kind of an example of an FND. How might it else present and what might it look like?
So let me clarify. Stomach problems are not an FND. They can be a functional syndrome, but they're not a functional neurological disorder. So that I was just explaining what functional meant in that example.
In that example, right.
Right. So functional neurological disorders can be motor, like paralysis. They can be sensory, like hearing loss or vision loss, or they can be cognitive, like speech difficulty. So the classic example, very common example, is when a patient might have what looks like a seizure, but there's no epileptic source in the brain based on EEG evaluation, or a neurologist might look at a video that the parent takes of these so-called seizures and realize that the movements aren't typical for an epileptic seizure. So FND symptoms really vary widely. They can be temporary paralysis of one or more body parts. They can be drop attacks where the person passes out and drops to the floor. They can be sudden temporary blindness. I had a client who had one FND symptom where she couldn't feel warm temperature, so she couldn't tell if something was warm. And the symptoms feel very real, and they are. They just don't have a purely medical cause. So it's thought that FND results from the brain's disruption in the way it interprets signals. And just to be clear, in terms of the non-epileptic seizures, they used to be called PNES, psychogenic non-epileptic seizures. Are sort of called that, but they're under the umbrella of FND. You can have epileptic seizures that are actually epileptic and FND, non-epileptic seizures.
That complicates things for sure.
Yes. And that's fairly common also.
Right. So really we're talking about, symptoms, behaviors that manifest like in the motor system, sensory, cognitive, and there's no identifiable medical cause for the symptoms that the person is demonstrating. Now, let's talk about why these symptoms might occur. Are there specific risk factors that make certain children and teens more likely to develop FND?
Yeah. So, for example, chronic pain is not an FND, but these two symptoms definitely co-occur or happen at different parts of the same person's life. So if you have a history of medical ailments, you're more susceptible to developing an FND. And, with pain and FND, people are becoming very hyper vigilant. They're scanning their body for symptoms, and that's making it more likely for symptoms to occur. It tends to happen in people who have anxiety or OCD or depression. Also, most people with FND are female between the ages of 14 and 40. And I have to say that the incidence of FND has really skyrocketed since the COVID pandemic. We have an increase in anxiety, and also FND symptoms are particularly susceptible to contagion between peers. And I put contagion in quotes because it's not actually contagious in the way that a virus is. When you have things like TikTok videos or people are showing their FND symptoms, it's really easy for people to subconsciously develop the same symptoms under the, quote unquote, right circumstances. So, in terms of the cause, just like when we talk about chronic pain, we have to look at it from the biopsychosocial model. So you have the biological susceptibility, maybe there's sensory or medical issues, and there's even brain changes that happen from having FND that perpetuate it. Then you have the psycho part of biopsychosocial, and that's the really important part. It's when people have emotions that they're not expressing, or trauma that they haven't processed, or stressors that they don't know how to handle, or negative ongoing situations they don't know how to escape from. The body can express what's going on through these FND symptoms. So there's actually evidence that the emotion center of the brain, the amygdala, communicates to the motor area. And so, it can affect how the body moves. And these connections can then get reinforced. And then there's the social part of biopsychosocial, and that has to do with how the family and the school and the church, all interact with the person, and how those institutions or those settings reinforce the FND symptoms accidentally, and, the stressors that could be causing them through family issues or school issues.
Right. And as you talk about kind of the increase in FND since the pandemic, I'm thinking about the stress of that time period. but then also that so many young people were online continuously. And I can see the interaction with social influences like TikTok contributing to that rise in cases and that contagion that you talked about as well.
Yeah, there were instances where there were, 15 girls in one school who had FND symptoms or Tourette's-like symptoms, tics. And then, when it was dealt with, those symptoms all went away. So, yeah, there's the anxiety that happened during the pandemic. There was the isolation. There was the increase in social media use, stress from parents, all sorts of things that happened during the pandemic that made it more kind of the right situation for these symptoms to emerge.
Right. And for parents who might not understand what they're seeing or may not even have had a name for the behaviors that they've been seeing until, listening to this conversation, I think you providing information about how some kids are more at risk for FND. You talked about chronic pain, individuals with anxiety, OCD, depression, unexpressed emotion, or past trauma. All of those factors can contribute to the development of these FND symptoms. And so it's important for parents to kind of hear that. And if they're seeing some of the behaviors that you described, to consider that and maybe connect with a professional who can help them.
Absolutely. And it can be really a broad spectrum of symptoms. I had one client her leg would just kick. It can be like a motor type of tick. It can be suddenly feeling freezing cold in one part of the body that doesn't make sense. I mean, it can be really any kind of neurological, sensory, motor, cognitive. It could be loss of speech, like suddenly the person can't speak. So the symptoms are really diverse, but they're neurological in nature.
Right. And parents are often unsure about how to respond and what to say when their child is having an FND episode. Can you provide some guidance here? Because are there things that parents should be avoiding doing?
Sure. So even though the symptoms can be really terrifying to the patient and the family, of course, I mean, the good news is that they're really pretty easily and successfully treated by psychotherapists. And the family, like you're saying, is a really big part of treatment with FND. When you're dealing with FND, you really have to involve the family. You have to involve the parents in the treatment. So once you have to rule out medical causes, of course, that has to be said. And once that's done and practitioners feel the symptoms are definitely psychogenic, then you can start with how to respond. So one of the things is to look for the triggers. That's really important. You want to look for the emotional and physical triggers to these episodes. So the triggers can be external. It can be like hearing parents arguing or bright lights or loud sounds. It can be internal, like feeling really anxious, or it can be physical, like feeling fatigued or being in pain. So you have to keep a log really of when these episodes happen and look for those trends and those triggers, because knowing the triggers can help avoid the situations that cause the symptoms. And then you can, figure out how to reduce them that way. And you have to realize that triggers can also generalize. So let's say a kid feels like every time they walk in the door from school, the first thing their parent does is like hammer them about what's your homework, what do you have to do, and all these kind of things, and it overwhelms them and they have an episode. That can generalize to then like every time they walk in their front door, even if it's at night or, on a weekend, they could have an episode because it's like generalizing to that setting. So the parents also should be looking at maybe what the function of the symptoms is. Like, let's say the person has an epileptic seizure or a drop attack, or can't talk or can't move. Does that help your child avoid conflict or intense feelings? Does that help them avoid expectations? Does that bring them attention? So you want to look at, is my child getting more attention during these FND episodes than they are otherwise? So a lot of times, if a child is craving attention and they're getting it during these episodes, they're getting secondary gain from the symptoms. So we have to make sure that we're not reinforcing them. So I think it's best to use an example of a non-epileptic seizure for this. So that's really terrifying, right? You're a parent and your child is having what looks like a seizure. That's very frightening. So first of all, I tell the parents, take a deep breath, try to relax. So the more upset and panicky you are, the more attention is going to be brought to the episodes, and that's not a good idea. So during one of these episodes, and practitioners call them episodes, not seizures. That's really important. I always tell parents, stop calling them seizures. They are not seizures. Because if when you call it a seizure, it really makes it sound more serious and more scary. And then other people respond to your child very differently if they think they have a seizure disorder, and they're very careful and they're kind of scared. And you don't want people treating your child that way because that will make symptoms worse. So when they're having one of these episodes, you don't want to crowd around. You don't want to hold them. You don't want to keep talking to them. You don't want to be soothing them, comforting them. I know that sounds really awful and like really unkind, but this is the way to get these symptoms to go away. So move your child to a safe place if they're not in one already, and just say something like, hey, you're having an episode. You're safe. I'll be nearby and I'll come back when the episode is finished. Something really simple like that. If you were in the room, knitting or reading when they were having the episode, just go back to that. Or if you were cooking, just go back to cooking. You can check in and peek in every once in a while, make sure your child is safe. Sometimes they have to be moved away from, something that they could hit their head on. But really try not to give a lot of attention to it, and look for times to give your child a lot of attention when they're not in these episodes. And I know a lot of parents say, like, well, what do we do with drop attacks? Because suddenly my child falls and I'm really worried that they're going to hit their head. And that's a really valid concern and really scary. This is a situation that really has to be delicately worked out with your therapist and the doctor. But most of the time, kids do not hit their heads and get injuries during drop attacks. And maybe because there is some small amount of consciousness still there. I had a client she had non-epileptic seizures and a lot of other symptoms of FND, but one of them is she would have these drop attacks. And she tended to have them in the bathroom when she was about to get in the shower, which is really scary because you don't want to hit your head in the bathroom. She never once hurt herself. And I'm not saying that can never happen. So I don't want to say that, no one can hurt themselves, but the tendency is that they don't. So even if your child's not having a non-epileptic seizure, if they're temporarily blind or deaf or paralyzed, aside from obviously meeting their basic needs, you don't want to pamper them. You don't want to go overboard. You just, when the episode is over, you just go back to what you were doing and have the same expectations of them that you would normally.
And that can feel so counterintuitive to parents who want to help, which is why getting guidance from a professional when your child has FND is so important. And I'm thinking about what type of language should parents use when describing FND or the child's symptoms to the child who is, because a lot of parents are thinking my child believes they are having a seizure. So what kind of language should parents be using, or do professionals use when speaking to their child about their symptoms?
Well, one of the things before I say that is just the way that you react and behave around it. So, for example, we make sure that parents and schools don't call 911. So if they were having an actual epileptic seizure, you probably would call 911, but you don't want to do that in this situation because then you're just adding attention to it and you're, making it seem like it's much more extreme than it is. So part of it is just the way that you function around it. But remember, most people having FNDs are at least mid-teenagers. So, they understand when you say, hey, this is something that's really happening in your body, but it's really coming from issues having to do with not getting your feelings out and not processing things that have happened to you, as opposed to something that is going wrong in your brain that needs, medicine for. And often I'll have my clients even do physical therapy just to kind of connect better their brain and their body. So I always tell parents, like, really have a time to, after the episode's done and you're away from it, to talk about, like, hey, what's going on before that? What were you feeling? What were you stressed about or anxious about or upset about? Because that starts to send the message of what means. So, really encouraging your child to express their feelings and validate them, even if they're angry feelings. And you can give your child a journal to write, or, to draw feelings in, or you can model expressing feelings to your child and really invite your child to share her feelings using open-ended questions, and praise your child for being open about those feelings and not judging them. Because a lot of times kids or teens with FND feel like they can't express their feelings openly to their parents without repercussions. So it's really essential for the parents to notice how they react to their child's especially negative emotions. Like, if their child is angry or sad, do they usually be like, it's fine, you're going to be fine, or get defensive instead of really validating those feelings? So I think it's important for parents to maybe say something to their child like, hey, I feel like your feelings, really build up inside of you, and then they eventually explode. And that's the FND symptom. It builds up, builds up, builds up, and then it explodes. Then you have the non-epileptic seizure. So you really want to talk to your child about the triggers and how to express their feelings.
What else does treatment entail? So for families who might be listening to this, and again, may not have had a name for it, who have been seeing this, maybe they're in the process of just going from doctor to doctor, trying to understand it, and may not even have an FND diagnosis yet, or maybe in the early stages of getting the FND diagnosis and trying to understand. What does treatment look like for FND? What does that typically involve?
It typically involves individual therapy with the teen who has the FND symptoms. And during that therapy, you're addressing anxiety, depression, OCD, trauma, panic, phobias, whatever is happening. Usually, I find that it's mostly that these kids don't feel okay expressing negative feelings, and they have anger that's built up. They have sadness or traumatic experiences that have built up that they really haven't been able to discuss and release. And so that happens in that situation. We talk about all of that, and we talk about triggers, and we also talk about coping strategies. So, what can you do to deal with these triggers instead of letting your body go into an FND? And I'm not saying they're consciously letting their body do that, but if they have other coping strategies they can use, so when the anxiety starts to build up, if they can use their breathing or their mindfulness or their creative healing types of activities to deal with that anxiety, they're less likely to go into an FND episode. So we talk about, noticing the triggers, noticing if some kids will have a feeling that they're going to go into an episode, some don't. If they do have that feeling, then we talk about, okay, what can you do right then? Here's a coping strategy to not go into it. So those are the types of things that we talk about in individual therapy and that we do. Then there's always working with the parents on their responses, their reactions, not paying attention to the episode, paying a lot of attention and creating fun experiences to connect with their children when they're not in an episode. We talk about how to interface with the school. That's a big one. So we talk to the school about accommodations, about how to inform the other students and the teachers about this, not to overreact, just let it happen, go on with the teaching, have the students ignore it, do not call 911. I have to say, I'm not sure I've ever even had a client who had an FND episode at school. I know that there are some people who do, but it's really rare. Um, so they don't tend to have them at school. But you want to have all those systems in place. And then often there's doing things like physical therapy to try to kind of reinforce that connection between the brain and the body to have control over it. Like one of my clients who had FND, she didn't really understand at first why she was going to physical therapy. And then she started to realize, oh, this is helping me have more confidence in my body. I feel stronger in my body. I feel more like grounded in my body with physical therapy. So, and then sometimes, learning guided imagery or meditation can be helpful because a lot of times, this comes from stress and anxiety. So, and then of course, if there is a history of trauma or PTSD, then we need to work on that as well.
Right. I mean, this is a really comprehensive approach to treatment. It seems like it needs to be in order for it to be effective. It's not something you can do, one-on-one with the client and not involve the family, because their response to the FND symptoms is important for the treatment outcomes as well.
Absolutely. So an example, a client of mine, they came to me when she was 13 and she was having, I think, about 15 non-epileptic seizures a day. And so and she has she has a genetic disorder that has other very extreme medical issues that she has to suffer with. So, so the first thing was, or not first, but one of the things was the individual therapy with her, talking about her anxiety, talking about her fears. And then she started talking about not feeling that her parents validated her emotions. And the parents really had a really hard time with negative emotions. And it was more that they felt bad for all the other medical issues she was dealing with. And they felt that by talking about it, it would make her feel bad. But and if she expressed fears or sadness, they didn't want to reinforce that. So they would just say things like, you'll be fine, which was their way of trying to be helpful. And they loved their child and they wanted to be helpful, but it didn't make the child feel understood. So, and then the other thing that was happening that came out was that one of her parents would often ask her the same question over and over and over again. And she would get overwhelmed by that. And so when that would happen, she would just go into an episode. It was like, she kind of described it like peace out, like, it was the way she could escape it. And so I worked with the parents. I worked with her alone. I worked with the parents alone on their behavioral response to her. And I worked with them all together on her being able to express her feelings to her parents and having them practice validating them. And one of the things that was really important with this family was that the first time I met with them, which was the whole family was on Zoom during the height of the pandemic. And she went into an episode during the Zoom, and I witnessed everybody just like, it was almost like she had two older siblings. Everybody just sort of hovered around her and coddled her and babied her and held her. And her sister, they said that she couldn't hear during the episode. So her sister had developed this strategy of writing letters on her hand. It was like a whole system in place. And the family, particularly, because this was the youngest child, was very busy. And everybody was off doing their own thing. And parents were very busy with work, and older siblings were very busy with school and after school activities. And she was sort of like on her own a lot. And this was a great way for her to get attention. And I'm not saying she did it on purpose. This is absolutely subconscious. but it had the effect of giving her attention. So when we turned that around, I mean, I think it was a matter of a couple of weeks where she went from, 15 episodes a day to like 3.
Mm-hmm.
So you really can turn this around pretty quickly.
Right. And I think it's so important, again, the language that you used. And it also kind of highlights how important language is with validating the emotions and not undermining the treatment outcomes by using language like you're faking, right? You would never want to use that type of language because this is brain-based.
Absolutely. And there are people who do fake illnesses, don't get me wrong, but that's not what this is.
Right. That's not this.
And it's terrifying. I mean, imagine suddenly when they have temporary blindness or deafness, they really can't see or hear. I mean, they really can't. They're not just saying that. That is absolutely terrifying. Or if suddenly you cannot move your legs and they just don't work, that's really scary. So we have to also really, talk about how scary it is with the person and not, gloss over that. But to help them understand that even though their body seems so out of control or their child's body seems so out of control, that there are effective treatments. And the other thing is that because this typically happens with teens, it also kind of disrupts typical milestones like going to sleepovers with your friends or going to drive. You can't drive if you have a non-epileptic seizure. So, I have a client who had them, and it was really sad for her because she had to go 6 months without an episode to be legally allowed to drive. And she'd get to like 5 months and then she'd have one and be like, oh my gosh, this is so unfair. And I do urge parents to really try to have their teens do as normal of activities as possible, that are safe. So, a lot of parents say, when I meet people, when I start working with people, I often find that parents are not letting their teen be alone for even a second ever. They're always with them literally 24/7. They sleep in the room with them. They're with them no matter where they are, unless they're at school. And that's not good for a teen's development. And so I understand that you're trying to keep your child safe. And of course, that's what parents are programmed to do is, right? We want to protect our children, but that's just not good for them. And what happens is it actually reinforces the symptoms because their normal teen development is then disrupted, which actually causes anxiety, which causes the symptoms to be worse. Plus, it's putting unnecessary attention on the symptoms and reinforcing that, you're sick, something is wrong with you. So I would say, let your child be alone. They are very unlikely to get hurt. Yes, of course, if you hear something, go in and check on them every 15 minutes if you want. Peek your head in the door, but don't have them never be allowed to be alone.
Right. And are there other practical strategies parents can implement at home to reduce the likelihood of episodes occurring?
Yeah. One of the things is to have the parent get their own support for themselves, because the more anxious and fearful that the parent is about episodes happening, the more likely they're going to happen, because that tension is going to translate to the child, because a lot of these kids are really sensitive kids who pick up on their parents' emotions. So it becomes a vicious cycle. It's like the parent is stressed out because the kid's having an FND symptom. And then, then the kid is stressed out because the parent's stressed out, and it goes back and forth. So I would say for the parents to get their own help, and for the parents and the kids to engage in creative activities that are engrossing and calming, either alone or together. And for the parents and the kids to do some mindfulness or meditation, either alone or together. Some of my clients have just, at night, they'll lie in bed next to the parent and do a meditation together. And then the parent will get up and go out of the room. So that can help both of them. Sometimes it's really helpful to encourage kids, even if they are not in school because of whatever's going on, to engage in, art class or guitar lessons or something that is creative that can really help body healing.
And for parents who, may feel overwhelmed, and I imagine most families feel overwhelmed, particularly initially, who might feel overwhelmed by an FND diagnosis for their child, any words of hope, encouragement that you'd like to share? I mean, you've had a number of experiences with families. You've seen kids improve. Anything you'd like to share?
Yeah, I want to say that I promise that there's hope. There really are effective treatments, and it does take time and it does require the participation of the entire family at some level. But in the end, I actually, and I'm really serious about this. I know it's going to sound crazy, but I actually see it in some ways as a blessing because it really helps the child and the family gain insight into their feelings and learn more effective ways to handle stress. The FND is almost like a light going on saying, "Hey, there's a problem here. I'm not able to handle my feelings, or my family is not able to handle my feelings, and I need help with that." And so if they didn't have the symptoms, that could just kind of fester for a long time and cause other issues, but it highlights them. And I have one of my clients, her mom really learned in this process how to feel and express her own emotions. And for her past family and the setting in which she grew up, feelings were not allowed. Negative feelings were not allowed. This mom's mom passed away when this mom was a teenager. And they basically just, oh, mom died, have the funeral, go back to school the next day. No one ever talked about it. No one ever talked about it. And so she grew up where feelings were not okay. And so she wasn't like that with her child, but that was in there. And so the child was expressing her feelings through these FND symptoms. And this mom is so grateful to our work because it helped her grow. It helped her change and her realize that it's okay to express feelings. And so the two of them have really grown through this process. I'll give a funny little anecdote that one of the things that this girl did when she was a teen with these symptoms is, and it's not always so symbolic, but sometimes it can be. She was talking about how she was driving in the car in the back seat, riding in the car, and that her leg kept kicking and it kept kicking the seat in front of her. So I said, "Oh, so who was in the seat in front of you?" And she said, "My mom." And I said, "Oh, what were you feeling about your mom?" "Oh, I was really mad because she had da da da." And I go, "Oh, okay. So you couldn't express your anger. So instead you were kicking the back seat, of the seat she was in." And she just started laughing. She hadn't even realized it. It's not always so direct like that, but sometimes it can be. And I told her mom and she laughed and we said, "Hey, we got to work on this ability to express anger to your mom, and mom's got to work on the ability to hear it." So they grow through this process. It's actually beautiful to see. I mean, the family of the girl I was talking about, that the whole family crowded around her, those parents also culturally are not used to expression of negative feelings either. And they really thought they were helping their child by not talking about her negative feelings or by not validating them. And they would just say, like, you're okay, it's fine when she's upset about something. And they have come so far in their ability to accept her sadness over social issues she encounters or medical issues she's encountering. And even the other day, I asked her, she has a progressive visual impairment that gets worse and worse, and she's almost blind, and eventually she will be. And I was talking to her about like fears of becoming blind. And she said, she really had no knowledge of what's going to happen. And I said, does anybody ever talk to you about this? And she said, no, I think they want to protect me. And I'm like, okay, that's not protecting her by not talking about it. This girl is going blind. It needs to be discussed, and her fears need to be discussed, and she needs to know what's expected to happen. So parents are trying to protect their kids often by not talking about things, but this is when these FND symptoms emerge if all of the feelings are being sort of, pushed down, repressed.
Right. I feel like there's so much good information that you shared in this episode that goes beyond just FND. The importance of emotions and understanding our emotions and expressing our emotions. And so I think that even if families are not dealing with FND, that information that you shared is going to be so valuable to so many families as well. And I can't thank you enough for being here. This has been such a wonderful conversation, and I appreciate all the work you're doing to support children, teens, and families who are struggling with this issue. If parents want to learn more or find resources for FND, is there any place that you recommend?
There's a lot of resources. There's a lot of research that's happening right now. I think if they can even just Google institution, Stanford is doing a lot of research. There are programs like Reactive. It's spelled RE and then a plus sign and then active. At Reactive, they have a sort of like all-in-one program where they have PT, OT, and therapists. And one of the things they specialize in is FND. So it's kind of one-stop shopping at Reactive, and they have programs around Southern California. I don't know if they have them in other parts of the country, to be honest. And then your neurologist may know of practitioners. And then you can also, if you're looking for therapists, if you look in a directory, you can put that in and see if they work with clients with FND. And if you're looking for a therapist to work for this, you really want to ask them if they are used to working with FND and they do it regularly, because if the therapist is not used to working with FND, they're not going to understand how to treat it behaviorally.
Right. And I'm going to make sure I put a link to the blog post that you wrote, because I think that's going to help. It's a great place for people to connect with good information as well.
Yeah, there's a blog. And then there's also a two-part series, a two-part webinar series about FND on the CHIP website. It's Creative Healing for Youth in Pain. So if you go to, I think it's mychip.org, and that's where you can find my blog on FND, but also the first webinar on FND should be there. I'm not the speaker. But then we just recorded the second one this week. So that should be up at some point. And then if it's not on the website, it will be on their YouTube channel, which is under Creative Healing for Youth in Pain.
Wonderful. And I will be sure to put links to where you can get access to the blog and the webinars in the show notes. So thank you again, Dr. Levy.
You are welcome. Thank you for bringing this important topic up and highlighting it.
Thank you so much for tuning in to today's episode. If you'd like to hear more from Dr. Levy, don't forget to check out our previous episode on chronic pain. We have the link in the show notes. And if you found this conversation helpful, please share it with other families who may be looking for some guidance. Thanks again for listening. Until next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.